Hello everyone, this is Gary Anderson. Hope you all doing well. In today's video, I'll be talking about diabetes and exercise. So, if you like the video related to my health, I would like to request you all please do subscribe to the channel, hit the bell icon, and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. No one's disputing the benefits of regular aerobic exercise for diabetes management. Running, walking, swimming, and biking can all help you keep your blood sugar level in check while boosting your overall health. But now, scientists are finding that people with diabetes can benefit from regular weightlifting or strength training as well. In fact, research in the Internal Journal of Cardiology shows that in people with type 2 diabetes, strength training can be more beneficial to blood sugar regulation than cardio, says Audra Wilson, RD, CSCS, bariatric dietitian and strength and conditioning specialist at the Northwestern Medicine Metabolic Health and Surgical Weight Loss Center at Delnor Hospital in Geneva, Illinois. That said, she points out that research in JAMA shows the best result come when strength training combines with aerobic exercise. Before starting any new exercise routine, it's important to talk with your doctor about any special consideration you need to make. Complication of type 2 diabetes such as heart disease, peripheral neuropathy, diabetic retinopathy, blood pressure issues, and osteoporosis can influence which form of exercise and strength training are healthiest for you, according to the American Diabetes Association. So, what's so great about weightlifting with type 2 diabetes? Lifting weight may make managing type 2 diabetes easier. Diabetes is marked by the body's inability to process glucose and use insulin efficiently, but strength training can help with those issues in various ways. Burns up blood sugar. Strength training relies primarily on the body's glycolytic or glucose using metabolic system for energy. As we go through a strength training workout, we use stored muscle glycogen for fuel, explained Nick Occhipinti, CSCS, an exercise physiologist based in Red Bank, New Jersey. Once this stored muscle glycogen runs out, we start to mobilize extra glycogen from the liver and from the blood. This helps you directly decrease blood glucose as well as deplete stored muscle and liver glycogen store, giving blood glucose a place to go next time we eat. Improves glucose storage. Your muscle surface storage facilities for consumed sugar and carbohydrate trained muscle has a higher capacity to store blood glucose in the form of glycogen, aiding in lowering blood glucose, he says. That means lower blood sugar level and easier glucose management. Spurs weight loss. In people carrying extra weight, losing 5 to 10% of your body weight can improve A1C score, the 2 to 3 month average of blood sugar level, according to Johns Hopkins Medicine. Apart from burning calories during your workout, strength training promotes fat loss by increasing level of lean muscle mass. Muscle is one of the few metabolically active tissues in the body at total rest. This means that even as we sit around and watch football or sit at a desk and work, the muscle we have on our body is serving to burn calories. Targets harmful belly fat. Abdominal fat, also called visceral fat because it resides in and around the body visceral organ, exacerbates insulin resistance and complicates blood sugar management. He explains that in addition to storing energy, visceral fat cells produce chemical and hormones that inhibit the body's effective use of insulin. Fortunately, high intensity resistance training is effective even more than cardiovascular exercise at reducing visceral fat level and managing blood sugar in people with insulin resistance, per the Internal Journal of Cardiology research. Lose belly fat fast with these diabetes friendly exercise routines. Strength training help protect against diabetes complication by improving insulin health and lowering high blood sugar levels. Strength training help guard against some of the complication of type 2 diabetes, but it also takes on diabetes complication in other ways too. Improves heart health. Type 2 diabetes is a leading risk factor in the development of heart disease, according to the Center for Disease Control and Prevention. Fortunately, strength training increases the level of good cholesterol in the body while reducing bad level. Research in the Journal of Human Hypertension shows it also helps lower hypertension or high blood pressure. boost bone density. While people with type 2 diabetes often have normal bone mineral density score, they are at a heightened risk of bone fracture, according to a study published in January 2016 in the journal Bone. Weight bearing strength training, especially performed from a standing position, will strengthen the bone of the leg, spine, and hips to reduce the risk of bone break. Prevent age-related muscle loss. Building muscle through strength training directly combat the muscle loss that can occur through the decades. According to the American Diabetes Association position statement, type 2 diabetes is an independent risk factor for accelerated declines in muscle strength. Research published online in January 2017 by plus one. So has linked severe age-related muscle degradation called sarcopenia to loss of physical function, cancer, and depression, and an increased risk of early death. Reduces the risk of peripheral neuropathy and vision loss. When we have chronically high blood sugar, glucose molecules start attaching themselves to everything, including our red blood cell. This can prevent healthy blood flow many places in the body where we have very small blood vessel. It just so happened that the eye and nerve of the hand and feet have these small vessels. When these areas don't get the blood flow they need, peripheral neuropathy and diabetic retinopathy can result. Strength training improves blood flow to reduce the risk of these complications. So 7 ways to stay motivated to exercise when you have type 2 diabetes. So 6 tips to starting to strength train with diabetes. The American Diabetes Association suggests that people with type 2 diabetes engage in 2 or 3 strength training sessions per week. On non-consecutive days, here are some strategies to help you get the most benefits from your strength training session. The first one, talk to your healthcare team. As with any exercise program, check with your healthcare team before starting a weight training regime. Especially important is to discuss is your blood sugar management. People don't typically associate strength training with the low blood sugar, but some patients will all have significant impact on blood sugar with the strength training. Your doctor may recommend testing your blood sugar level before, during, and after exercise, as well as eating carbohydrate around workout time to prevent or address hypoglycemia. Second, ask for help. To gain more health benefits from physical activity program, participation in supervised training is recommended over non-supervised program. For some guidance, consider working out with a certified trainer or joining a weight training class. These are offered both in person and online. Third part, focus on the body's largest muscle group. Work on your glutes, hamstring, quads, lats, traps, and chest. Some of the best strength exercises to target such groups are compound multi-joint movements such as squat, lunges, deadlift, hamstring curls, row, lat pull down, chest press, and push-ups. Follow a plan. The fourth one, mapping out what you want your workout to look like can help you make and keep a routine. If you plan to strength train 2 or 3 times per week, you're better off making all of your workout total body once. However, if your strength training is going to be more frequent, such as 4 or 5 days per week, alternating between upper and lower body workout or push and pull workout can help ensure that each muscle group still gets the recovery time it needs. Every now and then, try new variation of your favorite exercise or alter the number of sets or reps you are doing to keep your workout and result progressing. The fifth one, prioritize recovery. Giving yourself 1, if not 2 days in between working a given muscle group can help give it time to repair while still training it with sufficient frequency to adapt and grow. Great options include from rolling, stretching, and low intensity cardio like walking or cycling. 6 part, consider multiple tools. Yes, barbells, dumbbells, and weight machines can be used for strength training tools, but they are not mandatory. Resistance band, fill, duffel bags, and other household items are effective in loading the muscle and are especially great for helping you get in more at home workouts. So that's all about the diabetes in this video. I hope you all liked it. So before signing off, I would like to request you all, please still subscribe the channel if you didn't do that, and hit the bell icon so you will get the notification. So that's all. We will definitely meet in the next video with my another content. Till then, God bless you. Bye bye and take care.